Autism is a complex neurological and developmental condition that affects how an individual perceives and interacts with the world. It is characterized by a range of symptoms and abilities, often referred to as the autism spectrum. This spectrum means that individuals with autism can experience a wide variety of challenges and strengths, leading to unique experiences and perspectives. Understanding autism is crucial in fostering a more inclusive society that supports individuals and families affected by this condition. This image represents the diversity of the autism spectrum, with individuals of different backgrounds, personalities, and expressions. The vibrant and warm illustration conveys the unique perspectives and experiences of those on the autism spectrum. As we explore autism today, it's important to recognize the wide range of experiences and the need for tailored support and understanding. Autism spectrum disorder, or ASD, is a complex neurodevelopmental condition that affects how a person communicates, interacts, and behaves. ASD is considered a spectrum disorder because the symptoms and their severity can vary greatly from person to person. Some individuals with ASD may be highly gifted, while others may face significant challenges. Symptoms of ASD typically appear in early childhood, often before the age of 3, and can persist throughout a person's lifetime, although the specific symptoms may change over time. It's important to understand that ASD is a spectrum, and each person's experience with it is unique. The diversity within the autism community is something to be celebrated. Autism spectrum disorder, ASD, is a prevalent neurological condition that affects an estimated 1 in 54 children in the United States. ASD is characterized by a wide range of social, communication, and behavioral challenges that can vary greatly in severity. Diagnosing ASD involves a comprehensive evaluation by a team of healthcare professionals, including developmental pediatricians, child psychologists, and speech-language pathologists. The assessment process includes observations, parent/caregiver interviews, and standardized developmental and diagnostic tests to determine if an individual meets the criteria for an ASD diagnosis. This slide provides an overview of the prevalence and diagnostic process for ASD, setting the stage for the rest of the presentation. Individuals with autism often struggle with verbal and nonverbal communication, finding it difficult to initiate and sustain conversations, understand social cues, and express their thoughts and feelings effectively. Many people with autism experience heightened or diminished sensitivity to sights, sounds, textures, tastes, or smells, leading to discomfort, distress, or even physical pain in certain environments or situations. Individuals with autism often exhibit a strong preference for predictable routines, and may engage in repetitive behaviors, such as hand flapping, rocking, or obsessive interests, as a way to find comfort and stability. Shifts in environment, schedules, or activities can be particularly challenging for individuals with autism, who may experience increased anxiety, distress, or behavioral outbursts when faced with unexpected changes. Communication challenges are a core symptom of autism, affecting how individuals with autism express themselves and interact with others. Many individuals with autism experience delays in developing language skills, ranging from mild speech delays to complete nonverbal communication. This can make it very difficult for them to effectively express their thoughts, needs, and feelings. Individuals with autism also often struggle with social communication, such as understanding nonverbal cues, interpreting tone of voice, and engaging in back-and-forth conversations. This can lead to significant difficulties in social interactions and building meaningful relationships. Sensory processing issues, such as hypersensitivity to certain sounds or textures, can further complicate communication for individuals with autism. Loud noises or crowded environments can be overwhelming, making it hard for them to focus on and process verbal information. It's important to be patient, use visual aids, and find alternative communication methods to support individuals with autism and help them express themselves more effectively. Individuals with autism often struggle to interpret and respond to social cues, like eye contact, facial expressions, and body language. This can make social interactions feel uncomfortable and confusing, leading to challenges in building and maintaining relationships. Engaging in back-and-forth conversations and participating in group activities can be especially difficult for those with autism. The unpredictability and unwritten rules of social interactions can be overwhelming, causing individuals to withdraw or struggle to join in. The sights, sounds, and stimuli of social gatherings can quickly become overstimulating for individuals with autism. This sensory overload can trigger anxiety, discomfort, and a desire to remove themselves from the situation, further hindering social integration. Autism often leads to heightened sensory sensitivity, where everyday sights, sounds, textures, or smells can feel overwhelming or even painful, causing sensory overload and distress. In contrast, some individuals with autism may experience hyposensitivity, where they have a diminished response to sensory input and seek out intense sensations to feel the world more acutely. Maintaining sensory regulation is a significant challenge, requiring self-awareness, coping strategies, and environmental adjustments to create a calming, comfortable space. Occupational therapists use sensory integration therapy to help individuals with autism better process and respond to sensory inputs, improving the brain's ability to organize and interpret sensory information. Autism is often characterized by intense, laser-like focus on specific interests or activities. This can manifest as an obsession with a particular topic, object, or task, leading individuals to devote significant time and energy to understanding it in great detail. Repetitive behaviors are also common, where individuals engage in repetitive physical movements or rituals as a way to self-soothe, manage sensory input, or provide a sense of predictability and control. Individuals with autism may also have a narrow range of interests or activities that they are deeply passionate about, becoming all-encompassing and leading to extensive knowledge and a desire to share their expertise. Individuals with autism spectrum disorder, ASD, can have a wide range of cognitive abilities, from intellectual disabilities to exceptional talents. Their cognitive profiles are often uneven, with strengths in certain areas and challenges in others. Many individuals with ASD have enhanced perceptual abilities, such as heightened visual, auditory, or sensory processing. This can lead to exceptional skills in areas like pattern recognition, memorization, or attention to detail. Individuals with ASD often approach problems and tasks in unique ways, focusing on specific details or using unconventional strategies. This can result in innovative solutions and creative thinking. Early intervention is critical for individuals with autism spectrum disorder, ASD. By identifying signs of autism early, we can conduct comprehensive assessments to understand the child's unique developmental needs. This allows us to implement personalized intervention strategies, such as behavioral therapies, occupational therapy, and speech-language therapy. These tailored therapies can make a significant difference in long-term outcomes for children with ASD. Early detection, assessment, and personalized intervention are the key pillars of effective early intervention for autism. Applied behavior analysis, ABA, is an evidence-based approach that uses positive reinforcement to teach new skills, improve communication, and foster social interaction. It involves structured, individualized interventions to shape desired behaviors and reduce challenging ones. ABA has been shown to be effective in helping individuals with autism develop a wide range of abilities. Pivotal response training, PRT, is a naturalistic approach that aims to motivate the child and build on their interests. It teaches communication, social, and self-care skills through child-directed activities and reinforcement of spontaneous behaviors in everyday situations. PRT emphasizes the importance of following the child's lead and engaging in playful, meaningful interactions. The floor-time/developmental, individual difference, relationship-based, DIR, model focuses on building emotional connections and relationships. It encourages parents and therapists to engage in effective, child-led interactions to help children with autism develop social and cognitive skills. The floor-time/DIR approach recognizes the importance of tailoring interventions to each child's unique developmental needs and differences. Early intervention is critical for individuals with autism spectrum disorder, ASD. By identifying signs of autism early, we can conduct comprehensive assessments to understand the child's unique developmental needs. This allows us to implement personalized intervention strategies, such as behavioral therapies, occupational therapy, and speech-language therapy. These tailored therapies can make a significant difference in long-term outcomes for children with ASD. Early detection, assessment, and personalized intervention are the key pillars of effective early intervention for autism. Applied behavior analysis, ABA, is an evidence-based approach that uses positive reinforcement to teach new skills, improve communication, and foster social interaction. It involves structured, individualized interventions to shape desired behaviors and reduce challenging ones. ABA has been shown to be effective in helping individuals with autism develop a wide range of abilities. Pivotal response training, PRT, is a naturalistic approach that aims to motivate the child and build on their interests. It teaches communication, social, and self-care skills through child-directed activities and reinforcement of spontaneous behaviors in everyday situations. PRT emphasizes the importance of following the child's lead and engaging in playful, meaningful interactions. The floor-time/developmental, individual difference, relationship-based, DIR, model focuses on building emotional connections and relationships. It encourages parents and therapists to engage in effective, child-led interactions to help children with autism develop social and cognitive skills. The floor-time/DIR approach recognizes the importance of tailoring interventions to each child's unique developmental needs and differences. Occupational therapy plays a vital role in helping individuals with autism develop essential life skills and lead more independent, fulfilling lives. Therapists work closely with clients to identify and address specific needs, empowering them to enhance their independence. Many individuals with autism experience sensory processing challenges, and occupational therapists use specialized techniques to help clients better regulate and integrate sensory input. This can reduce anxiety and improve overall functioning in daily activities. Occupational therapists also work with individuals to develop adaptive strategies and tools, such as visual schedules, communication boards, and assistive technologies. These personalized solutions can enhance communication, organization, and participation in various environments. Through targeted interventions, occupational therapists help individuals with autism build essential skills, such as social interaction, fine motor coordination, and executive functioning. This holistic approach supports overall development and increases their ability to engage in meaningful activities. Medication management is an important aspect of supporting individuals with autism. Targeted medications may be prescribed to address specific symptoms like anxiety, depression, ADHD, or seizures. These medications are carefully selected and monitored by healthcare professionals to maximize benefits and minimize side effects. Effective medication management involves close collaboration between the individual, their family, and a team of providers like doctors, psychiatrists, and pharmacists. This collaborative approach ensures a personalized treatment plan that meets the unique needs of the individual. Maintaining medication adherence is crucial, as consistent use of prescribed medications can significantly improve symptom management and well-being. Healthcare providers work with families to develop strategies to overcome any challenges in sticking to the medication regimen. Inclusive classrooms provide a supportive and nurturing environment for students with autism, where diversity is celebrated and students feel safe to learn and grow. Educators in inclusive settings use a range of evidence-based strategies to cater to the unique learning needs of students with autism, including visual aids, sensory-friendly materials, and individualized support. Inclusive education provides opportunities for students with autism to develop essential social skills, such as communication, collaboration, and empathy, through peer interactions and structured social activities. Transitioning to adulthood can be a significant challenge for individuals with autism, but with the right support, they can develop the skills needed to live independently and thrive. Self-advocacy is crucial. Learning to effectively communicate their needs, preferences, and rights empowers them and prepares them for independent living. Vocational training and job placement services can help identify their strengths, interests, and potential career paths, supporting a successful transition from school to the workforce. Mastering daily living skills like money management, meal preparation, and time management enables them to live independently and confidently as they enter adulthood. With the right support system and skill development, individuals with autism can successfully navigate the transition to adulthood and lead fulfilling, independent lives. Autism is a unique set of strengths and challenges that individuals bring to the workplace. By providing personalized, job-matching services, we can identify the specific talents and abilities of people with autism and connect them with roles where they can thrive. Creating autism-friendly workplaces with sensory-friendly environments and flexible schedules is key to enabling individuals with autism to succeed. Mentorship programs that pair people with autism with experienced professionals can offer invaluable guidance, support, and opportunities for growth and advancement. Together, these strategies can unlock the full potential of individuals with autism and create more inclusive and diverse workplaces. Raising a child with autism can be an incredibly challenging and emotionally taxing experience for families. They may feel overwhelmed by the stress, anxiety, and even depression that comes with navigating the unique needs and difficulties of their loved one. Families often face significant financial burdens due to the high costs of therapies, specialized education, and medical care required for individuals with autism. This can put a major strain on family resources and add even more stress to an already difficult situation. Many families also struggle to find adequate support services and resources in their communities, leading to feelings of isolation and a lack of understanding. Accessing the right support systems is crucial for families coping with autism, but it can be a real challenge. Autism often comes with unique mental health challenges like anxiety, depression, and difficulty regulating emotions. These co-occurring conditions can significantly impact the overall well-being and quality of life for individuals with autism. Effectively addressing mental health issues in autism requires a comprehensive, multidisciplinary approach. This includes therapies, support systems, and accommodations tailored to the individual's specific needs. Collaboration between healthcare providers, educators, and families is crucial for delivering this holistic care. Adopting healthy coping strategies like mindfulness, self-regulation techniques, and social-emotional learning can promote emotional wellness for those on the autism spectrum. Siblings of individuals with autism often face unique challenges, from dealing with their siblings' behavioral differences to navigating the impact on their family dynamics. Acknowledging and validating the experiences of siblings is crucial to providing them with the support they need. Encouraging siblings to learn about autism and develop empathy for their siblings' unique needs can help strengthen their bond and create a more inclusive home environment. Promoting acceptance and understanding can also alleviate any feelings of resentment or frustration siblings may have. Carving out dedicated one-on-one time for siblings can help them feel valued and recognized as individuals, not just as part of the family with a child with autism. This special attention can go a long way in supporting their emotional well-being. Autism is a complex neurological condition that affects how people communicate, interact, and process information. Raising awareness about autism is crucial to break down stereotypes, foster acceptance, and ensure those with autism have the support they need. Educational campaigns, media representation, and community events can all help increase understanding and awareness of autism. Individuals with autism and their families must advocate for equal rights, access to resources, and inclusive policies. Advocacy efforts are essential to ensure the needs of the autism community are recognized and addressed. Autistic self-advocacy organizations and support groups empower individuals with autism to have a voice and lead meaningful lives. These groups provide platforms for sharing experiences and driving positive change for the autism community.